name is Serra, and I'm here with Dr. Jennifer Carter from the University of Oxford, and she is one of our keynote speakers. So we invited her today to ask if she could introduce herself and also give a summary of her keynote lecture.
Thanks, Monica. I'm Jennifer Carter, and I'm a senior research and teaching fellow at the University of Oxford in the Department of Population Health. And I spend half my time teaching as associate course director on the MSc Science in Global Health and Epidemiology. And then I spend the other half of my time doing research on obesity and nutrition with large-scale prospective studies around the globe. And this is really what fed into my keynote talk today, was I did sort of a whistle-stop tour around the globe, thinking about how can we lead cardiovascular health forward. And in order to think about that question, I addressed three main points, and that was we have to get the data, okay? We have to get big data, and we need to get data in diverse populations. And I illustrated this showcasing a lot of the large prospective cardiovascular epidemiology we do in my department. So we started by looking at 150,000 participants followed in Cuba. We looked at 150,000 participants followed in Mexico City. We looked at 500,000 followed in India. We looked at 500,000 in the UK, 500,000 in China, 120,000 in Malaysia. And it's really thinking about, where are the similarities, where are the differences when we look at risk factors for cardiovascular health? How can we use that to sort of drive our preventions and our treatments and our understanding of disease moving forward?
Since you're using such a diverse cohort of studies, I imagine that the data being collected across the different studies is very different. So how do you think about utilizing the data in an efficient way, but also what advice would you have for people trying to design some of these studies in order to get the best outcomes out of them?
I think the most important thing is to get the data, and having some data is better than no data. And there's really good examples of the insights you gain for public health when you go out and you actually take measurements in the local population. You can see what the local context is in terms of their cardiovascular health and risk factors that, they're dealing with in their day-to-day life. So you get some data. And it doesn't have to be overly complex. I gave a really good example of Cuba where they had this really short questionnaire. It was just one side of A4 paper. They did it during the economic crisis of the special period in Cuba. And even just one piece of paper, just looking at classic risk factors like blood pressure, height, weight, smoking and alcohol, they've generated amazing research in their population on the risk factors in their population and where the public health priorities need to go. So it doesn't need to be complex. It can be simple. And the goal is to just go out there and take those measurements of the key behavioral, lifestyle, modifiable risk factors, look at who's getting treatment, look at who's not. And this can really set the research and the policy agenda to help your local health.
One of the things that you keep pointing out is the importance of that there are so many modifiable factors. And I think that's the exciting thing about this research that you're doing is identifying those and how can we actually design and prevention and interventions going forward. So thank you so much for your time, and we hope you enjoy the rest of the conference.
Great. Thanks very much, Monica.